Dr. John Mullins. We're live here at Marshall Lifestyle Medicine, and this is the fourth installment of this video. While we were away, we had a comment or a question, more of a comment than a question, and he was actually absolutely right. A fair amount of people that undergo this procedure within a couple years will regain the fat, even though we try to instruct them on lifestyle-related treatments to avoid that. At our clinic, and the reason that I believe that we're not going to fall into those statistical categories is because we're a comprehensive wellness practice. People come to us primarily for us to make them feel better overall. This is an adjunctive treatment that we provide. When people are finished with this procedure, we're going to work with them for, many of our patients join our practice as an M Club member, and so we work with them for years on making sure that their health is optimal. So we're not going to allow patients to fall back into that trap of regaining the fat that we remove from them. And it's a great question, and I think that's probably why the treatments that we offer here are superior to maybe you can get at a plastic surgeon's office, because they just focus on getting the fat out, then you're discharged from the practice. Here, you'll stay with us for as long as you'd like, hopefully forever. So right now, we're finishing up the liposuction procedure. I'm actually in what I call the sculpting phase. I debulked and did the part that removes the majority of the excess fat. Now, the part that is the artistic component is when you're actually going in and just trying to model it in such a way that the outcome is superior. So I spent probably most of my time on this component. So the next hour or so, I'll be working on this to try to get the absolute best result for this patient, because that's what she wants, and that's what she deserves. So were there any other questions that came across, Casey, or
in the 2-month follow-up, what do they go through each week?
2-month follow-up. You know, the weight loss component?
Right. I just explained this to one of our other patients.
Well, you know, this young lady's going to come back tomorrow morning, and we're going to take a look at her wounds and just assess them. Probably next week she's going to come back, is going to meet with Terry, our health coach, and we're going to talk about diet, nutrition a little further. And we're going to just really focus on the next 2 months on making sure that our outcome is optimal. Our health coach, Terry, will contact her twice a week, make sure that she's going down the straight and narrow with respect to her diet and exercise. She's going to be seeing me so that we can monitor her medications that we're going to use to help her facilitate some weight loss. We're going to see her from the liposuction perspective at 1 week, a month, 2 months, 3 months, and 6 months, just to make sure that her results are optimal. Every now and then we have to do a little touch-up, and we tend to do that with our cool sculpting machine, because every now and then there's a little irregularity that we don't predict, and that's why the cool sculpting machine is such an adjunctive, fantastic thing to have with us in our practice. So anyway, I appreciate everybody tuning in on this procedure. We're going to post some before and after pictures over the next month on this particular case. You know, come in sometime and have a consultation with me. They're free. Our office number here is 287-2515. Look forward to talking to everybody in the very near future. Thanks again.